Hello, vetmates! Today I will be talking about the postpartum recovery, also known as the puerperium. It's a wild mix of rest, recovery, and round the clock parenting as the animal world welcomes its newest members. The postpartum phase or puerperium begins right after birth and continues until the reproductive system regains its normal function, facilitating another pregnancy. The length of this period, known as uterine involution, and the resumption of ovarian activity varies among species. In polyastrous animals, having a shorter puerperium is economically beneficial. For example, dairy cows require frequent pregnancies for optimal milk production, while swine and beef cows benefit from shorter intervals between pregnancies, improving offspring and meat production. A longer puerperium, on the other hand, delays pregnancies and reduces productivity. The four major events of the puerperium are the myometrial contractions and expulsion of lochia, endometrial repair, resumption of ovarian function, and elimination of bacterial contamination of the reproductive tract. Here is a table showing the time required for uterine involution and resumption of ovarian activity in various species. For example, we have here an alpaca, which requires 20 days for complete uterine involution and 5 to 10 days for the resumption of ovarian activity. For this next figure, we have the ruminant model in the major events from parturition to subsequent conception, which will be discussed in the following slides. During postpartum, strong and repetitive contractions of the myometrium help expel fluids and tissue debris, compress uterine blood vessels to prevent hemorrhage, and shrink the uterus to its normal size. In dairy cows, this process, uterine involution, is vital for fertility. Although in most species, frequent suckling induces regular contractions through oxytocin secretion, dairy cows experience fewer contractions due to early calf removal and infrequent milking. This delay in uterine involution may affect fertility in dairy cows. Next is the expulsion of lochia during and after uterine contractions. Soon after parturition, the uterus discharges lochia. It is a blood-tinged fluid containing remnants of fetal and endometrial tissues. This discharge is common in postpartum dairy cows and generally lasts between 2 to 9 days. The presence of lochia, while normal, is sometimes misinterpreted as a sign of uterine infection. This leads to the unnecessary treatments that can further delay recovery. Myometrial contractions within the first week post-birth reduce the lochial volume, which naturally aids in uterine healing. Next is the caruncular repair process. Within 8 to 12 hours after birth, fetal cotyledons separate from maternal caruncles, resulting in vasoconstriction and the necrosis of caruncular tissue. The necrotic tissue is expelled through lochia. By the 5th day postpartum, caruncles start losing structure and shedding tissue. As the caruncles repair, the endometrial epithelium gradually covers the surface, marking the end of this recovery phase. We will now discuss the bovine reproductive organs and their postpartum recovery at various days. For the day 1 postpartum, the cervix displays remnants of the cervical mucus plug and minor hemorrhaging occurs due to trauma from delivery. The right ovary shows no active structures, while the left contains 2 corporal lutea, indicating double ovulation. The uterus remains enlarged, with one uterine horn bigger due to housing the fetus. During the day 4 postpartum, lochia is expelled through the cervix, and both ovaries show signs of corpus luteum regression. The uterus has shrunk from 85 centimeters to 58 centimeters. Most decidual tissue has sloughed off, mixing with blood and other fluids. For the day 10 postpartum, hemorrhagic sites are still visible, but the cervix has contracted. The ovaries begin showing signs of follicular development, and the uterus continues to shrink, now measuring 41 centimeters. Caruncles are healing and lochia becomes less prominent. During the day 15 postpartum, clear mucus secretion suggests the cow is entering its first follicular phase. The ovaries contain antral follicles and the uterus is close to its pre-pregnancy size. Lochia is nearly absent and the caruncles are nearly covered with new epithelium. Lastly, during the day 20 postpartum, the cervix and vagina return to their normal appearance, and the ovaries show continued follicular activity. The uterine horns are almost back to their normal size, with the mucus replacing most lochia. The caruncles have nearly returned to their pre-pregnancy state. For the changes in caruncular height, the caruncles along with the surrounding endometrial surface undergo repair postpartum. The endometrium in the intercaruncular areas usually heals faster, while caruncles, due to their larger size, take longer to restore. Lastly, we have the postpartum uterine bacterial contamination. Bacterial contamination of the uterus is common after birth in domestic animals due to the non-sterile birthing environments. While myometrial contractions help expel lochia and bacteria, some infections can still occur, particularly in cases of retained fetal membranes or weak uterine contractions. However, natural defenses, such as the increase in estradiol during estrus, help eliminate most bacterial infections. While the treatment of uterine infections remain controversial, returning to estrus plays a critical role in resolving bacterial contamination. That's it for now, vetmates. I hope you learned something from this video.